I'll be presenting my study on a comparative analysis of morphometric changes in the anterior chamber angle after cataract surgery. So a brief introduction on AIOC20. AIOC20 was developed after OCT, which was developed for retinal imaging. And we use a wavelength of 1310 nanometers. It can be used both for quantitative and qualitative assessment of the angle. And if we compare it to the UBM, AIOC20 has a disadvantage of not providing visualization of structures posterior to the iris, such as ciliary body, zonules, and peripheral lens. The aim of the study was to study the changes in the angle of the antechamber after phacoemulsification and manual small incision cataract surgery using an SD-OCT. So our objectives were to study the changes in the anatomy after cataract surgery and to justify the role of cataract surgery as an adjunctive treatment for control of IOP. And we also wanted to perform a quantitative assessment of the changes after cataract surgery. And we also had to study the changes at the site of incision and the site opposite to it. So we conducted a quasi-experimental study in the Department of Ophthalmology, AIIMS Rishikesh, and the study was approved by the Institution Ethics Committee. We had enrolled around 60 patients, and they were divided into two groups. Group A had 30 patients who had undergone phacoemulsification, and Group B had 30 patients who had undergone small incision cataract surgery. The division of the patient in the two groups was according to the patient's preference for a foldable or a non-foldable IOL. So in both the groups, patients had undergone preoperative routine ophthalmic evaluation, and all the surgeries were performed by a single surgeon under identical conditions. And Group A underwent phacoemulsification through a 2.75 mm clear corneal incision, and Group B had undergone manual SICS through a 6 mm frown incision, which was placed 1.5 mm from the limbus. In all the patients, the IOL was placed in the bag. So we evaluated the patients preoperatively and post-operatively at 1 week and 6 weeks. The evaluations were done by the same observer under identical lighting conditions and undilated pupils. So the parameters that were evaluated were central antechamber depth, antechamber angle, antechamber opening distance, which was 500 and 750 microns from the scleral spur. We also evaluated trabecular iris space area, which was placed at 500 and 750 microns from the scleral spur. So what we found out was that all the parameters showed an increase from preoperative to postoperative 1 week, as that can be seen in the graph. But from 1 week to 6 weeks, all the parameters in both the groups tend to show a plateau. And in Group A, the parameter that showed maximum increase was TISA 750, which showed an increase of about 45%. And in Group B, that is the patients who had undergone manual SICS, the parameter to show maximum increase was TISA 750, which had an increase of 49%. And after evaluating and comparing the results of both the groups, what we found out was that the changes brought about in the angle parameters were similar in both phaco and manual SICS. And both the changes were similar at the site of incision and the site opposite to it. So this is a table of Group A. The blue table is of at the site of incision, and the orange table is of opposite to the site of incision. And this shows the changes in the parameters from preoperative to 1 week and 1 week to 6 weeks. This table belongs to the Group B, and this side is the at the site of incision, and this is of opposite to the site of incision, showing an increase from preoperative to 1 week and 1 week to 6 weeks. So to conclude that the antechamber, what we found out from the study was that antechamber OCT can provide valuable data regarding the changes in angle of antechamber. And the angle parameters, they show an increase. The maximum increase, what they show is from preoperative to first week. And then they tend to stabilize, as that can from the graph that the parameters show have a tendency to form a plateau from 1 week to 6 weeks. And the changes are brought about both at the site of incision and the site opposite to it. And in terms of changes in the angle parameter, both the surgeries, phacoemulsification and manual SICS, are almost similar, and the changes are comparable. Thank you.
Thank you, Dr. Mahsa, for the wonderful presentation. Very, very descriptive.